Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. The patient in this procedure is actually an avid YouTube fan, that's how they found me, and they have developed a fungal infection in the right ear. They're receiving treatment from their GP in the form of caniston ear drops, but as you can see, it's very impacted with medial debris and dead keratin, and they're struggling to hear. So just using a Zollner suction probe here, and just trying to detach this dead debris, dead skin, and we're pulling it away from the anterior recess, which is a region in the front part of the eardrum. You can see some dead keratin here that we're just pulling upwards out of the inferior recess. It's almost like a magician's trick when they're pulling their handkerchief out under their sleeve and it keeps coming and coming. There's a long tail of dead skin there that wasn't really visible to the naked eye initially. Now, there's a lot of debris around the edge, which I'm going to remove. You'll see that at the end of the procedure. But the patient has almost got kind of two corns or verrucas on the eardrum. So sometimes when the eardrum has been infected, the skin on the eardrum, as it's trying to fight the infection, it's shedding the skin, and this skin can get hard and crusty and thick. And you can see there's one kind of, we can call it an eardrum corn, I suspect, just here where I'm working on. So that will just naturally heal itself with the drops. You can't do anything else with that. And there's a second kind of corn of a verruca a bit higher up on the eardrum superiorly. You'll see that in more detail in a moment. So what I've done now, I've got the fine end gauge and I've had to bend the distal end. I don't know if you can just see the bend. It will become in more focus a bit later. And this, by bending the fine end gauge, it enables me to work on the anterior part of the ear canal near the eardrum. And we can see we're just delicately peeling all this dead skin off. So when anyone's got an ear infection, I try wherever possible and safely as possible to peel off any dead skin. It just helps them recover from the infection. It allows any treatment, any ointments to make direct contact with the ear canal itself. So there's the second corn, just where I am now with the suction probe. You can see there the eardrum kind of moves. It's a thick layer of dead skin there. And that will now naturally heal with the correct treatment. And there's some dead keratin here it's more on the roof of the ear canal. It's not on the eardrum, but we're quite medial. We are on the bony part, so we just have to be really gentle. So you need a really, really steady hand for this, and obviously you need the optics. I saw a video the other day, it was emailed to me, of someone performing an ear procedure with a different device, and I was just so appalled by the quality of view. To me, it looked like an ultrasound of someone who's pregnant. It looked like a baby. It was so poor, and I will try and upload that side by side to the view you get with an eye clear scope. It was quite shocking and revealing actually. So you can see the eardrum's fully visible. You've got these two corns of verrucas, just thickened dead skin there on both eardrums. The ear canal and eardrum is really dry. If you remember when I first went in, there was a lot of liquid there as well, which was suctioned out. And I've advised the patient to avoid water in the ear. That's so important. And that's general advice to everyone. Even if you don't have problems with your ears, don't take the risk. If you do get water in your ear, you may be one of those unfortunate people who then suffer from chronic ear infections. You see another layer of dead keratin that I've just gently peeled. The patient could hear significantly better, but I have advised them to continue with their course of treatment. When we're suctioning, clearing all this dead skin, it doesn't kill the infection. We're just killing the dead skin and debris that has been secreted by the infection. So the fungal infection is still active, so they still need to use the caniston ear drops. I hope you enjoyed that procedure, and you're all enjoying your Thursday evening or morning or afternoon, depending upon where you're watching it. And make sure you all have a lovely Easter weekend. Take care. Bye.